Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to give you our bi-weekly update on the coronavirus pandemic in the U.S., in Maryland, and here at GBMC. So as you've been seeing on the news is good. Both the states of California and New York have announced that they are relaxing restrictions. And the reason is because the case positivity rate is now very low. There are many fewer new cases in populations across the United States. Here in Maryland, our test positivity rate is below 1%, meaning that of 100 people who get tested, only about one is positive. And that is significantly better than where we were just a few months ago. You've also heard that our governor has announced that effective July 1st, he is eliminating most of the restrictions that have been in place to keep us safe during the pandemic. This morning, there were 167 people in Maryland hospitals, either in regular beds or in the intensive care unit. And this number is the lowest it has been since we have started measuring. So all the news is good. At GBMC today, we have 4 people who are COVID-19 positive. 2 of those are in the intensive care unit and are fairly sick. None of them have been vaccinated. And this is probably the conversation that we need to continue having. Why do we need to vaccinate when the amount of disease in the population is pretty low? Well, the answer is clear. It's the difference between pandemic and epidemic. Pandemic means a wave of disease, in this case, due to a virus that goes across the whole world. An epidemic means an outbreak of a disease in a given area that can be circumscribed by geography. We all recall hearing about outbreaks of measles. The last one I remember was in California when somebody brought measles in from outside of the United States, and there were enough people who had not been vaccinated against measles to start a small outbreak of measles. There will be epidemics of coronavirus after this point when people are relaxing restrictions. Why? Because there is still coronavirus out there in the world, and in some states, for example, California, only 45% of the population has been immunized. Some others that have not been immunized will have immunity because they had the disease, but there are still a lot of individuals who are susceptible to the disease. You may have been also seeing on the news conversations about the so-called Delta strain. The World Health Organization is now changing the way it names the strain, and we are up to Delta. The Delta strain is also known as the Indian strain. Many people in the country of India have gotten very sick, and some have died from that strain. And it appears that that strain is more easy to transmit than the strain that has been prevalent in the United States. So this is the reason why, even though right now we're in a good place, we want people to continue to be immunized. Also, since we last spoke, the Maryland Hospital Association has taken the lead in getting hospitals across the state, having a conversation with them, studying the evidence, and deciding that Maryland hospitals should require all of their workforce to be immunized. Johns Hopkins and the University of Maryland here in Baltimore have committed, and GBMC has committed to requiring COVID-19 vaccination by September 1st. And again, why are we doing that? It is because we are scientists and we are following the scientific logic to protect our patients first, because many immunocompromised people walk through the doors of Maryland hospitals every day. Those people could get very sick, and many have and have died from getting the coronavirus. Since their immune system is not working, they don't get the advantage of vaccination, and those around them need to help protect them. Primarily, at the top of that list are healthcare workers. Some of my colleagues are disappointed that we are requiring this. Some argue that they don't need the vaccine because if they get ill, they will not die. Well, they don't know that. It's true that people with weakened immune systems and the elderly are more likely to die, but we have had deaths of people in their 20s and 30s. But I want them to hear from me a big reason to get vaccinated, even if they believe that they will do fine, is to protect others. And that is the nature of being a healthcare worker. We are in service to others. It is their right to not be vaccinated, but it is also our right to protect our patients and the rest of our workforce by requiring vaccination. So, yes, at GBMC as well, by September 1st, we will have a requirement for people to be vaccinated. Obviously, there are medical reasons why people should not be vaccinated, and those will be taken on a case-by-case basis. And also, there are religious exemptions for the vaccine as well, and we will recognize religious exemptions. I want to again thank all of the healthcare workforce for standing up to this horrible scourge. We need to remind ourselves that over 9,000 people have died in Maryland from coronavirus, and over 600,000 Americans have died. And we need to try to put an end to this by doing everything that we can. Healthcare workers have stood up against it. Thank you. And let me remind you that we are here for you if you need our help at GBMC. Thank you very much.